when my gynecologist told me I had polycystic ovarian syndrome, my face was exactly like this. Like, what was going on? Does this mean that I have a problem that I have to treat? Or is this like a death sentence? I was diagnosed at the age of 21. Well, at that point of time, I had irregular periods. When he was doing the ultrasound, the first thing that he showed me was this are your ovaries, your left and your right ovaries, and we have this thing what we call as a string of pearls, if you could see, around your ovaries, in your ovaries technically. And they said, yang ini semua bintik-bintik hitam ni, okay, this most likely indicates polycystic ovarian syndrome. So after that, he drew some bloods and it did show some levels where my testosterone level was slightly on the higher end, and a couple of my female hormones were also on the lower end as well. And that was when he concluded that with my symptoms as well, he said, I don't know whether it's a fortunate or unfortunate event, you have polycystic ovarian syndrome. We're talking about treatment options with my gynecologist during the same setting. He told me this: if you want to get pregnant and you want to lose that insulin resistance, let's go on metformin. But if you want to, try to regulate your periods and not looking to get pregnant, you can go on oral contraceptives. And then he said, lose a bit of weight, which did not make sense to me because I thought I was underweight. And how I found out that I was lean PCOS, because number one, weight gain, like crazy gain, was not something. But I also noticed that my energy levels were shit. It does not mean that insulin levels in my body is a wreck. Okay, it's havoc. So after telling with the symptoms, it did relate to me that it does look like I'm lean PCOS. Talking about lean PCOS, I'm not too sure if I'm supposed to feel fortunate or unfortunate because of the size that I am. But I feel you should not, think about polycystic ovarian syndrome if you are lean and you don't have polycystic ovarian syndrome. We also have ladies who have regular periods and also polycystic ovarian syndrome as well. So to sum it up, I think don't just ignore your symptoms. If you have any, get yourself checked out. And I stumbled upon preventive medicine and I went for the course, and I found out it was also used for patients with polycystic ovarian syndrome, which really caught my eye. I have hormone optimization and also hormone replacement, which is what I am on. It is called bioidentical hormone replacement therapy, and so far that I've been on this, it has been regulating my periods. I've been feeling on top of the world. I have really great energy. I don't feel tired. I don't feel angsty as often anymore. So I would say when we talk about preventive medicine and hormone optimization, it's more towards quality of life in the long-term run, which is great. So something to definitely think about if there's no alternative in terms of, the common medical world. A lot of times people ask me, so you've been in medical school? Most likely you know what PCOS is. No, the answer is no. It made me even more confused. They did say these are the symptoms of polycystic ovarian syndrome, girls. So they say hirsutism, which is facial hair or just hairy, okay? Acne, okay? And then afterwards they say chubby and infertile and then irregular periods. No. When I look at myself with polycystic ovarian syndrome and I was diagnosed and when I was in medical school, right? And then you see all these symptoms and you're like, but they're not telling, right? With medical school, it made me even more confused. You guys, do not ever ignore when you have symptoms of polycystic ovarian syndrome or any of the sort. Don't be shy or don't get worried to not check it out. I think that is really, really important. Once you get diagnosed with polycystic ovarian syndrome and you don't know where to go, always find places to get help. And if you don't know where to get help, there's always my PCOS ahead of you. We've been going through this for many years now, and never better, never better, never better. Made me learn how to embrace who I am, what I am, and I'm so happy to be living with what I have.